It's only 15 minutes. So Dr. Khadanga and Dr. Kanungo will at least we should stop within 15 minutes. Okay. So Dr. Khadanga, please start.
Welcome to NUCD 24. This is the 10th NUCD, and in this session we have a very important guest, Dr. Utkal Kishore Khadanga, who will be speaking on exercise and diabetes. What precautions we should take, but who are allowed to do exercise and all that. As you all know, physical activity and exercise has some definite difference. All physical activities are not exercises, but exercise is what is coordinated, regulated, and energy consumption can be measured. Dr. Khadanga, welcome to this event.
Namaskar. Thank you, sir.
Namaskar. Our viewers would like to hear from you many things because you are one of the front runner as a doctor, also an expert doctor, and also a expert health keeper. You have been running 42 marathons. You do every day 30, 40, 50 kilometers cycling, sometimes 200 kilometers, sometimes 600 kilometers cycling. And there is no event in the city that you don't, but you go to other cities to do, as you are telling, on this 20th you have Mumbai Grand Marathon. So a doctor who is so exercise savvy and understand the exercise basics and everything, advanced things, my first question to him will be whether all diabetics need exercise or not, from type 1 to GDM.
So the answer is exercise is the one of the most and strongest pillar of type 2, type 1 or GDM management, of diabetes management. So all the patients who are diabetic or non-diabetic should exercise. There is no doubt about that.
Because we have all known, and it is a scientific fact, that if you do exercise, your longevity increases. Because diabetes and exercise are part and parcel of the treatment and its relationship. So, what are the factors that affect glucose response to exercise? How do you think so?
So the factors that affect the glucose response is the type of diabetes. The type 1 diabetic and type 2 diabetic, they respond differently. The duration of diabetes, the medications the patient is on, like whether the patient is on insulin or OHA, or which type of OHA he is on or she is on, and what is the metabolic control of the patient, whether the control is good or bad, what is the A1C status, how much insulin or what kind of insulin patient is taking, and where is what is site of insulin and which part he is going to exercise.
A patient has come and sitting in front of you, 54-year male, and he is diabetic for last 10 years, and he has never gone for exercise or walking or anything. What will be your advice to him, and what will be the precautions that you want to suggest to him?
If the patient has led a sedentary lifestyle for a long period, I would ask the patient to start with 5 to 10 minutes of walking only. So the types of exercise, if you say, or intensity is low intensity, moderate, and vigorous. Low intensity is just walking. So let the patient start with walking of 5 to 10 minutes. And patient has to first, know the physical status, like where he stays and where patient wants to go. The patient has to be motivated first. If I'm only telling the go and start walking, 30 minutes a day, patient will never listen. So I have to tell him that what is going to benefit by starting exercise. Okay, what he is going to see after 6 months when start the exercise with the blood glucose control and the body weight and the blood pressure control, and then start slowly, like 5-10 minutes of walking, let's say for 1 week, 2 weeks, then gradually increase to 15 minutes, 20 minutes, and so on, and keep a target of, let's say, 30 minutes after 2 months.
So counseling and telling patients in detail really helps.
Right, sir.
Who is only walking now, suppose the person says that yes, I walk 5 kilometers a day, and you see that he is not achieving his target, what other exercises do you recommend him?
Sir, I recommend what the person loves the most. We cannot, compel a person to go for swimming or cycling or strength training. The patient loves, he or she loves dancing. So I would recommend a patient go for dancing at least twice or thrice in a week, apart from the walking. So variation is very important. The patient is continually doing 5 kilometer walking and there is no change. So we have to change the routine. So I may ask the patient loves a bit of weight training, so you can go and do a strength trainers or the physical strengthening exercise with light weights or machines. Or the patient loves dancing, patient go for dance, Zumba. The patient loves outdoor sports. He can go play tennis, basketball. So it all depends what the person likes, and we have to imbibe with that.
That is very important, as you have rightly told. And if you ask physical trainers, they say yes, there is called aerobic exercise, there is weight exercise or resistance exercise. For viewers, would you like to explain a little better about these two varieties?
Right, sir. So basically, the three types of exercise: one is aerobic exercise, one is strength training, and the third one is balancing and stretching. So the aerobic exercise is basically recommended for all the patients, and as per the ADA guideline, or what we recommend, at least 150 minutes of aerobic exercise per week. But with that, we try to imbibe two strainers or the muscle training exercises at least twice in a week, apart from aerobic exercises. So that by adding this weight training exercises, that increase the muscle decrease muscle resistance, the insulin sensitivity increases, and the muscle mass increases. That helps in losing body weight, losing blood pressure and cholesterol. And as per the ADA guideline, if I go as per the guideline, the young type 2 diabetic patients or type 1 diabetic patients or adolescents, it is recommended at least 60 minutes to 70 minutes of physical activity with aerobic exercise 5 days a week, with 2 times of this muscle training exercises. For adults, it is recommended at least 150 minutes of per week of the aerobic exercise, at least with that this muscle training exercises. And for the older adults, at least the balancing and stretching exercise is recommended.
These are our young children. They want to play. They want to do everything. They want to swim. They want to cycle with speedily because their friends are doing that. So after 10 years or 7 years, 8 years, till 15, 18 years, what do you recommend to our type 1 diabetes, and how do their parents know how to maintain the blood glucose during exercise?
For type 1 diabetic, I ask the type 1 diabetic patient to lead a normal life like any other peer group or any other friend, with cut down of the sweets, but rest all food the patient can take apart from this easily or simple sugars. But activity, cycling, this running, swimming, everything he can do. And I ask them to add 1-2 classes of this physical training or the weight exercise. What you asked rightly said, sir, how the parents should take care of that. So they have to check a blood glucose before starting exercise. And if the blood glucose is less than 90, then I ask the parents to give a 15 to 30 grams of simple carbohydrate or glucose, and thereby 0.5 to 1 gram per kg per hour of continuous glucose if the patient or the person is doing exercise for 1 hour. And
tell me.
And if the blood glucose is up to 150, it's fine. Patient can continue with the same. If it's 150, 250, then no need to start or give the carb load. Patient can keep on doing exercise till the blood glucose falls to 150. Once it is 150, then patient can take glucose of 0.5 to 1 gram of glucose per kg per hour. If it is above 250, it is not recommended to exercise. We should check the blood ketone. And so that time we should be a bit careful.
Very nicely explained. About pregnant women?
So all the pregnant women, Those who do not fall into very high risk category, they are advised for again say 150 to 175 minutes of exercise, aerobic exercise per week with 1 to 2 sessions of this muscle training exercises. And also yoga is advisable for them. And they should. It's nothing like, once person is pregnant, they cannot do exercise and keep on eating and put on body weight. So exercise is a must for them. And even the GDM patients, it is advisable to increase those 150 to 250 minutes per week so that they will not put on the extra weight.
And up to which month they can do this?
They can do this exercise even up to 40th week of pregnancy.
Oh, till they can continue.
Yeah.
Oh, very good. When exercise is discussed, we diabetologists always think exercise is one part, but sedentary lifestyle is another part. The person, we measure how long he's sitting and not becoming active. What do you recommend on that?
So now the term has come, sitting is new smoking. Okay. If you sit continuously for 6 to 8 hours, so that puts on, extra the comorbidities, diabetic and, the cardiac comorbidities. So we have to, sit and every 30 minutes, get up and, go for a stretching or bit of rotational exercises for 5 minutes and then come back to sitting. So sedentary habit that has to be discarded, and we can do this intermittent exercise that you sit for 30 minutes, get up, do some 5 minutes stretch and again come back to a sit.
Some elderly people, it has been found that during gymming drop down dead. Even younger people have dropped down dead,
Right.
even if not diabetic.
Right.
What is your word of precaution for that?
For non-diabetic patients, we do not recommend any cardiac checkup or any, this checklist before starting exercises. And what the reason behind these drop-down deaths could be a lot of stress, lack of sleep, lack of rest, and maybe drug abuse could be a reason. So these are the reasons, and but nobody can explain that what happened. But that is what I can think of. For diabetic patients, it is always recommended to take doctor's first from permission. Even the ADA 2024 guideline says for any diabetic patient, even if patient control is good, and if the patient is going to start even low intensity exercises, low intensity means just walking for 30 minutes, he has to take a clearance from his treating physician. So that's what I do recommend my patients, and patients who are planning to embark on a this vigorous exercise and or run a marathon. I would definitely ask them to go for a cardiologic clearance. And what the cardiologists usually ask for a stress ECG test, or they may ask echo ECG, and even few cardiologists ask for a CT angio for those patients who are going for a complete full marathon. So this is what is mandatory. They should go for this. Apart from this, they should check a urea creatinine level, lipid profile, and if diabetic patients should check a retinopathy checkup, they should do before that. So these are a few things we should keep in mind.
We see our gentlemen, they walk. They have groups, they go to the parks, they go for morning walks. But ladies are bound to the household work. And they have diabetes, they have truncal obesity, they have other problems. How do you advise our lady folk or the woman with diabetes?
So when I asked, ma'am, do you do exercise? Now, yes, I do a lot of work at home from morning to night. I do a lot of household chores. So that is that is day-to-day activity. That is not exercise. So for that, you have to devote at least 30 minutes to 40 minutes for yourself, which you are not doing day-to-day routine. So you have to take out time and go for a walking or yoga pranayama. If you cannot go to outdoors due to some restrictions, you can do yoga exercise, some stretching, some balancing exercises you can do. Or
any experience you have, somebody while doing exercise met with some emergencies and something was done for him? Any example?
Just last month, sir, I went for the Kolkata marathon, 25-kilometer marathon, and that time a doctor around age of 55 years, it just I crossed him and he fell down, and immediately ambulance was brought, and he was declared dead. So he was running with a group of doctors. So I inquired what happened. After they were like with a lot of stress, and after the marathon I asked, and they said that doctor was he went to America. He traveled just 1 day prior, and he had to do the marathon. Though he was physically fit, but he was completely no rest at all, and he came for the marathon. And
so body needs rest, mind needs rest,
absolutely.
muscles need rest before
Any exercise, we need number one, nutrition, rest, sleep, recovery, and also before that, before exercise, that pre-workout or warm up.
hydration also.
Hydration also, sir.
Hydration is very important.
Very important.
So, do you recommend proteins, extra proteins for people those who take do exercise and they do not have renal problem?
So for those who go for bodybuilding or this muscle building exercise, they tend to take extra protein, and it is required at some point also. Those who are going for competitions, and if their like kidney function test, urea creatinine, and clearance level is all right, so they can take a protein for 2 to 3 months with a break of again 3 to 4 months.
So,
if patient asks me, I tell them, be cautious, go for good brands, because you have to look at the brands. In India or domestic products, it has come like they have added steroids and all those things, and they sell it for the faster. But I tell them, go for a better brand, take it for 2 to 3 months during that your competition time. Again, give a break for 3 to 4 months, and again take for 2 to 3 months. But keep on checking the kidney function test. Yeah.
So you will recommend anybody diabetic going for walk or exercise to carry some glucose, some biscuits, some water along with?
Absolutely. That's a must. That goes without saying. So any diabetic patient taking insulin or OHA is always recommended to carry some lozenges at least in the pocket.
And as the traditional teaching says, that if there is a doubt whether it is hypo or hyper, hypoglycemia should be given preference.
Absolutely.
Absolutely. So, Dr. Utkal, it was excellent talking to you. A man who is really in the paramount position. All these medals suggest that how active you are in the day-to-day life in being a doctor. This will inspire other doctors also to advise exercise for them. And a national update on clinical diabetes is clinically oriented program, and we are thankful to you. Thank you very much.
The last word, do what you preach. Once you preach your patients, you have to do that by yourself so that they will listen to you. Thank you so much for talking to you.
Thank you. Nice meeting.